Hi everyone, this is Dr. E. Ravindra Reddy, consultant pulmonologist working at Kamineni Hospital, LB Nagar, Hyderabad. We are facing a challenge in differentiating flu from COVID infection. I shall briefly tell about what are the differences and how we need to go about. A flu infection would usually be acute in onset, wherein the transmission period would be from 1 to 3 days, whereas the COVID infection would start slowly and the transmission can happen from 2nd day to 14th day of illness. The mode of transmission in case of flu is by droplet infection, whereas in case of COVID, it's through the droplet infection and also by touching the areas where the patient is coughed, and then if we touch our hand, the nose or mouth or the eyes. Coming to the symptoms, in flu, one would have a cough, cold, fever, sore throat, body pains, whereas in COVID, one would have loss of taste, smell, of course, cough, cold, fever, sore throat, and they may also have loose motions, diarrhea, and loss of alertness, and any other symptom would indicate a possibility of a COVID infection. Then there comes a question of how to investigate these individuals. Flu does not require confirmation tests, whereas COVID requires confirmatory tests by way of a rapid antigen or RT-PCR through a throat swab. But after having diagnosed it, the treatment for the flu is symptomatic, whereas in case of COVID, we need to go for a gamut of investigations which would indicate whether it is severe or mild. Then we have to take a decision about whether to use a steroid or anticoagulation therapy, or they may also require ventilator support because they may develop pneumonia. And the infectivity of COVID is much higher than compared to flu because we are exposed to this new form of virus. It's an old virus with a mutation, and most of us do not have an immunity to it, whereas most of us have immunity to the influenza A and B, which causes the flu. Flu has a vaccine, but COVID does not have the vaccine. For more information, do come to Kamineni Hospital, and we shall take care of flu or COVID or a combination of both. Thank you and good day.